listening to the Pharmacy Podcast Network.
This year, the PPN partnered with KeySource and NimbleRx and interviewed key leaders in retail pharmacy and the impact they're making on public health. Here's the final episode of the three-part series of the Total Store Expo 2025 from the San Diego Convention Center.
Andy Crawford here with KeySource, NACDS 2025. It's been great spending time with you here in the booth. There's been constant traffic. Your meetings are all over the place.
Yes, sir.
A busy time. This is good.
Yeah, I mean, this is the show. This is our Super Bowl of the year. Back-to-back meetings, and it's so great to talk to these pharmacies from all across the country. You know, everybody's here rallying around the cause. How can they buy better? What strategies can they use to procure better? And really what's going on, you know, with reimbursement rates, really putting a lot of pressure on these guys and gals. And, you know, this is the place to be to talk about it. And I think both from the manufacturer side and from the pharmacy procurement side.
So let's go with that word, because there's strategy differences between our standalone independent community pharmacy that served their community for years and years, and some of them are struggling, some of them are doing okay. Now we have our regional chains, national chains. Some of the interesting stories that you've told is the collapse of some of those chains in many different ways. Rite Aid, for example, some of the closures that Walgreens are experiencing and CVS. And now this is giving an opportunity for the expansion of maybe our smaller chains, 10 locations. Talk to us about that and what you're noticing by talking to these operators and owners, the balance and struggle of that dynamic.
Yeah, I think you hit on something that's it's an interesting situation. You've got contraction and then you've got expansion going on at the same time. The contraction, obviously, of the store footprint of some of these larger national chains, the divestiture of Rite Aid, and you're seeing these smaller regionals have opportunity to absorb these prescriptions organically, these scripts organically, and some to the tune of hundreds, if not thousands, coming in regionally. And I think most of that is oriented around demographic, so it's not necessarily nationwide. But if you have a higher concentration of these stores that, you know, are contracting in a certain community, it gives a lot of opportunity for those that are in the regional space. And maybe in some of those independents might only have 6 to 8 locations. And it's really nice because they're able to come in and to provide a service that is lacking in that community for those that are contracting. So there's always opportunity and chaos, and I think the best out there are capitalizing on that right now. So it's kind of an interesting situation.
So the mix of operators and operations and pharmacies that you've met here at NACDS, there's energy and there's an element of a lot of positivity going on. What have you been hearing that is creating that hope and that opportunity for growth?
Yeah, I'd say there's always light at the end of a dark tunnel, and I think that pharmacy's been going through it, right? Everybody knows it's nothing new. I think the strain of reimbursements weighing on a lot, but I think a lot of people are, have a really good outlook on, new opportunities with maybe some high-dollar brands that have been genericized recently that could open up some leverage for them to be able to access more generics at a value. And what does that do for them? Increases their bottom line and profitability. And I think that's the struggle right now in this industry is how do you balance script volume, and not necessarily the increase of script volume doesn't always equate to profitability. So if there's these, economic factors happening within their procurement departments where they can buy better and have access to products that have recently genericized, giving them more leverage to be profitable and remain profitable, that's a huge benefit to them. So I think there's some excitement around, what next year holds. the obvious, ongoing, effort for reform within the PBM space. So I think there's a lot of, camaraderie at this show because you have an independent pharmacy, you have a chain pharmacy, might be regional, might be national. So you have somebody down to the single store, Bob's Pharmacy on the corner, up to those that have thousands of stores.
Right.
And they all have commonality between them, right? The betterment of the industry, the betterment of pharmacy, to ultimately do one thing: best care for the patient.
Yeah.
So
something that I've noticed in independents, and I'm wondering, since you talk to more regional chains than we do at the podcast network, and that is we have a rise in independently owned pharmacies no longer using one of the three primaries, and now they're 100% collection of a whole bunch of different secondaries, and they're kind of inventing their own contracting spins. So are you seeing some of that in the realm of our regional chains?
Absolutely. I'd say I highlighted it a little bit in episode 2 of our 3-part podcast. And I think the biggest patterns, I love to look for patterns. The biggest patterns I see are those procurement departments that followed a traditional channel. And that might have been procure from the primary through their PVA and maybe supplement direct if they can, if they have self-distribution. But what I'm seeing now is they have one thing they can control in the uncontrollable world of pharmacy right now, and that is buying better. And diversification of supplier partners it's not a hopeful, do it if I can. It's a must right now. It's no longer something that was on the side. It's an integral part of a strategy to procure. And I think you're going to see continued growth, leveraging secondary suppliers, more strategic purchasing initiatives that might not necessarily be leveraging a primary award with one certain supplier partner, but maybe diversifying. How can I proactively procure items that are high volume movers at a discount so I can impact my bottom line? So I think, they're open, lot more open-minded than the traditional paths in the past. And I would say, I know we're at NACDS right now, live podcasting, but I'm starting to see this bleed into other classes of trade within the pharmacy industry, which is kind of interesting.
Yeah, you've spoken to me about a mixture under the same umbrella where there's the community business, the long-term care business, the specialty business, and it's starting to really blend in differently than where the silos were very solid 5 and 10 years ago.
Yeah, I'd say specialty and institutional business, health systems. I think, I'll talk a little bit about now since you brought it up. I think, I come from a health system background. I used to, be a buyer at a health system, among other things. And, that's another area, another class of trade that has been pretty diplomatic about only using a traditional sourcing path. And, they're looking for ways to improve the bottom line, and it's outside that traditional path. So now more than ever, you see these purchasing alignments start to evolve into single supplier to multi-supplier sort of arrangements.
Hey, if you're listening and you want an opportunity to dig into your specific needs as a regional chain, as an independent, as someone who's really planning on growth, reach out to Andy Crawford at KeysourceLou.com. Andy, what has been interesting to you here at NACDS that you've been surprised about, or something that's really standing out?
I'd say, the deadline for NACDS TSE implementation is Wednesday of next week this industry. So that's a huge talking point. And I'd say what I'm surprised about, I guess, is how prepared some are and how ill-prepared others are. I'd say that most of those that are larger are very well prepared. KeySource has been prepared for about a year now, so we're in good position. But I'd say that's somewhat surprising to think that we're only, what day is it? Sunday. We're 3 days away from deadline, and you got people that quite haven't figured it out yet. So I know this has been a a model that's been kicked down the road a few times and delayed, but the party is starting Wednesday, so you better be ready.
We have a lot coming up here on the NACDS Total Store Expo podcast series brought to us by KeySource. Once again, thank you so much, Andy, for supporting us here covering this event.
Absolutely, Todd. Thanks so much. Talk soon.
Hi, this is Luann Myers, live from NACDS.
Hey, Luann, it's great to see you. Outcomes, we were so excited to be with Outcomes at ThoughtSpot 2025, and now we're here with you at the NACDS Total Store Expo. It's good to see you.
Yeah, good to see you. Yeah, I was jealous. It sounded like you had a great time in our booth and had some good conversations with John Carlson and some of our team.
Exactly. So that three-part series isn't even totally out yet. I think we're on episode 1 or 2 as it rolls out. But something that I'm excited to talk to you about, I want our listeners to dial in and hear from you. You have your finger on the pulse of trends, and there's a different environment when we're talking about regional chains and national chains versus an independent or a long-term care pharmacy or even a specialty pharmacy. So let's talk about the trends that you're noticing in the space of chain pharmacy.
Yeah, I think, being at Outcomes, we are interacting with over 65,000 pharmacies, so it puts us in a unique place to see what we're hearing from both retailers and independents. My space, being over enterprise, is that I work mainly with both retail and national chains. I've been at Outcomes for about 2 months now, and so one of the things I've done just coming into this position is kind of getting a top-to-top, trying to talk with all the leaders of our accounts and understanding what are their goals for 2025 and beyond. Mm-hmm. And I am seeing some common themes and sharing back what we're hearing from other leaders just so we can help inform them on what are some areas they might want to invest in. Because as you know, Todd, pharmacy has changed quite a bit. Yeah. So I'd say the 3 main areas that I'm seeing are, 1, you have to diversify your prescriptions. Volume is not the answer. Mm-hmm. We can't continue to just fill, cheap maintenance meds and be profitable. Mm-hmm. So how do they bring in more clinical services at a higher dollar rate? So maybe doing tips around blood pressure, where you can get a high dollar rate for doing that tip versus, getting a $3 generic filled and trying to get that with volume. The other point that I see a lot of, and I would say this is the number one thing that I've heard from pharmacy leaders, is we have to reduce our cost to fill. So whether that is prioritizing high dollar activities in the pharmacy or looking to automation. So I know we've had a lot of booth traffic today and yesterday looking at our pill count and virtual verification. So looking at things like that or going paperless, our central fill is continuing to be an answer for how do we free up or reallocate our pharmacy staff so that they're working at the top of their license and doing things that are more face-to-face in clinical care versus kind of administrative work. And then I'd say the third thing is really looking at strategic alliances or community alliances. So we're seeing a lot of trends with some of our retailers working with employers or local community. So that could be, filling scripts for a local employer and having lockers. That could be doing meds to beds for a local health system. Food as medicine, so maybe connecting with a local Meals on Wheels provider and helping, a patient that might be food sensitive. And so those are things that we're trying to help with folks to really dig into those programs to see maybe you are working with an employer today, but what are some other things you could do outside of just filling scripts with them? Like, would they be interested in maybe a smoking cessation program or other things there? So we think there's the pharmacy is often kind of the central point in the community. So what are some other things that we can help our leaders have conversations with some of those community partners?
Since the theme here is obviously our regional chain pharmacy at NACDS Total Store Expo, a question that I had that I knew you were coming, so I was excited about that, was Outcomes in a realm of a central fill environment, but then knowing what the NDC is, knowing what the therapy is, and now being able to put the treatment tracking system on top of that. Does pill count fit into that ecosystem?
Yeah, we've certainly had pill count can certainly work both at Central Fill and both at a local store.
Okay.
So, at Central Fill, we've certainly had, you have your larger automation when you think about, the canisters and things like that, but they also have to identify and count those products that go into that, but there's also things that don't fit into the large products that you might have a one-off count where people are still manually counting for things that maybe aren't fast movers. But then in the store, having someone manually count and verify, that's something that you can take labor out of and have the pill count machine do that for you. So, and especially if you're thinking about like controls or things that are double count, like having a machine do that and record that is a great service.
So some of the success that I'm hearing from pharmacies is going into special themes, whether that's women's health, birth control in some states, because now pharmacists can prescribe it. So is there any themes that you're noticing in the trends that are having a lot of success bringing new revenues into community pharmacies?
We're definitely seeing some trends. We've seen a lot of things in like blood pressure testing. I think that's one that we can see pharmacies making some good revenue on. We certainly are talking to payers to do a little bit more of that in the future. So those are things that, if they have the machine right there in the store, or they could get that value from their doctor, that's something that they could report back on. So those are some good things that we would like to see grow for opportunities in the future.
How about testing? How does testing fit into the outcomes system?
We do have medical billing, so depending on your state, there's a couple new programs out in Pennsylvania and Maryland that are coming out as we speak. So a little bit more details to come on that. But yeah, it is specific to what state there is. There are some testing that is like COVID and flu. Some of those are across the country, but there's other specific things. Some states are a little bit more proactive, kind of like this session today. It's kind of interesting per board, per state of what's allowed. So we'd like to see that a little bit more expansive, but at least in our system, if you go in, you can see what's applicable to your state to do medical billing. But we are seeing a trend with cash medical billing. We're certainly seeing that as a trend, especially for if you think about strep testing, especially for folks with children. The daycare calls and says, they've got strep, you can't come back until you've proven that they don't have strep. So to go in somewhere and get a cash strep test is something that they're willing to do and pay for, so they can take them back to daycare quickly. So.
Right, and it's important. A shout out to you, pharmacy owners and operators out there, to communicate those services to your community, to your patient base, to let them know that that's available.
Yeah.
Because the first thing that a person's going to do that doesn't realize that is they might call their primary care instead of their pharmacy, and their pharmacy can interact and be that hub of healthcare for them.
Yeah, absolutely. And I think it is important, Todd, to share that, because you want to protect and defend your business. Yeah. And there's no reason why you shouldn't be doing that, because they're already in your store. They're already familiar to you. I know in my own pharmacy, I know both pharmacists by name. They wave to me when I'm, in there for shopping. I mean, they're who I would want to treat. And quite frankly, I think I could get in and out a lot more quickly for something like that than, waiting, at urgent care. Where if I didn't have strep, that's definitely where I'm going to get it.
Exactly. All right. So how has the show been for Outcomes and your meetings, and how has this 2025 event been?
I think it's a great show. It's definitely, I think we have the best spot on the floor. We're right in the main alley, and we've been back to back. So it's been a great show. We always enjoy, seeing our clients and friends and colleagues here. So we've just really had a great time.
We so much appreciate you stopping by the press booth and giving us a testimony of how pharmacy is evolving through technology and pill count. We want to hear more about that. Thank you so much for being part of the NACDS TSE Total Store Expo post show.
Oh, thanks.
Hey, we are here at the NACDS Total Store Expo 2025, and I've run into Crystal Lennartz. It is so good to have you back on the podcast. How are you?
I'm doing well. Thanks so much for having me, Todd. A lot of energy here at NACDS Total Store Expo.
Absolutely. You were a big part of it. You had some presentations. You were extremely busy, as is the team. I walked past the McKesson booth, and it was constantly stacked with curiosity and people and discussions. I didn't get to see you at the booth, but I'm so glad that you're making this time for us now for the post show. Let's jump right in, because I know that you have interesting insights on such an array of how pharmacy is impacting our communities. You and I have talked many times back at the Idea Share, McKesson Idea Share 2025, about the independents and many of the things that they're working on. And there's some similarities between them and the chain, the regional chain and the national chains. But then there's other things that are very, special to either of those categories. So talk to us about regional chain and your emphasis and your excitement here at NACDS 2025.
Yeah, so I would say there are a lot of similarities in pharmacy, and particularly community pharmacy right now, regardless of if you're a large chain or a single store independent. So as we've talked about before, Health Mart is an independent pharmacy franchise, but we do support 4,300 pharmacies across all 49 states. Most of our pharmacies are located in rural and urban underserved areas, so they're often the front door to care in their community. And one of the things that's been really a focus at NACDS, and we talked about in a panel earlier today, was around technology, in particular automation and central fill. And this is an area that is important regardless of if you're a small chain, a regional chain, or an independent pharmacy. I would say pharmacies are increasingly embracing automation and central fill. They're looking to enhance their operational efficiency and be able to elevate their patient care. We saw interest at NACDS around solutions like McKesson Central Fill as a Service, which is really a full service pharmacy automation solution. It helps organizations to scale their prescription dispensing programs and do it cost effectively. And in particular, this is important for smaller chains or independents because they don't have as much capital, right? And so you can use this service without that burden of upfront capital to build your own central fill. And oftentimes our smaller pharmacies or rural locations might operate with leaner staff and tighter margins. So this helps to free up the pharmacist and technicians' time so they can focus on more patient care services. And then we also talked about an appetite for other types of automation, like inventory optimization tools and analysis. I think anything where pharmacies can free up cash flow right now that might be sitting on their shelves, like inventory, that's definitely been a focus.
So I know that the team is helping to implement automation, taking it step by step, helping those pharmacies to grow based on that planning. And then you just hit on something as I'm listening to you. When you are expanding or when you are growing or even adding automation, it's making differences in your workflow, which is impacting our technicians and how well they're used, how they're leveraged, how their roles are also changing, just like our pharmacist roles are changing, and they're doing more even treatment management. Now we're relying on our technicians to do more of these operational and customer service and even revenue generating opportunities through what the patient's needing. So talk to us about how technicians are being leveraged today.
Yeah, so I've really seen the technician role evolve and change. And you talked about them being the operational backbone a little bit, and I believe that's true. So whether it's in dispensing or also helping with things like inventory management, we've seen many of our member pharmacies match kind of the interests and abilities the technicians have and assign them even responsibilities beyond the counter. So whether that's managing the front end department or one of our Pharmacy of the Year finalists had a lead technician who's responsible for marketing and social media. And then just increasingly, if technology or automation or central fill are helping take care of some of that dispensing, I'm also seeing technicians increasingly involved in whether it's immunization delivery and support, point of care testing, remote monitoring. And so they might be able to help with documentation, medical billing processes, or in the case of immunizations, the actual delivery to the patient. And then the third area I'd love to touch on is just when technicians are able to be cross-trained, we're seeing a growing area is technicians as community health workers. And they've really always been at the center of their communities, and oftentimes they're the first face or voice that you would see when you go into the pharmacy. So I think they already have that deep trust, and providing the community health worker training just allows them to connect in a different way and more meaningful to be able to match that patient with needed resources. So whether it's tools like healthmart.findhelp.com, which is a closed loop zip code based social determinants of health resource, or other resources that might be in their community like transportation, childcare, nutrition services, food banks, diaper banks. I'm just really excited. We just recently had our third round of McKesson funded scholarships for community health worker training focused on technicians. And it's been amazing to see just the impact that they can have. Some of our first round of technicians have already made thousands of referrals and are continuing to serve as those frontline advocates. And from a Health Mart perspective, we're actively supporting expanding technician scope even beyond, what I talked about today through advocacy and also through preparing the technicians from a training perspective.
I love that, Crystal, and how you even touched on such an array. We started with operations, but you're also mentioning things like customer service, engaging the patient, wellness, follow-up, and then you touched on what I like to do, and I don't have enough time to do it, which is social media. So our own Shada Coldry, champion pharmacist owner in Tampa, our champion Dave Randolph, his technician team, both of those independent community pharmacies are leveraging that social media. And then now we're seeing other organizations, bigger chains starting to get into it, because people are realizing now it's such an important part of our communications to our public and reaching out to them through social and making it fun, but making it educational. Part of that reminds me of how artificial intelligence is impacting all of us, including some marketing campaigns, definitely in my team, really helping me with assuring transcriptions and leveraging the data we talk about. And we're going to start doing some cataloging of podcasts. But talk to me about AI. I mean, I can only imagine it in the hands of your technology team and in automation and the systems that you're putting into place. How do you think AI is going to affect our chain pharmacies throughout the nation?
Yeah, maybe I'll just start with marketing. How you mentioned, we have our Health Mart Marketing Edge platform for pharmacies, and we're seeing a lot more engagement in digital and SEO optimization. And there's a lot of practical applications there, from using AI to help develop content. So that's one space. I'm also seeing a lot of applications when it comes to the pharmacy and also back office support areas. One in particular that we have a partnership with is an AI-powered virtual assistant. So really it unifies the traditional IVR, web, mobile, chat interfaces, and it allows patients to interact with the pharmacies in the way that they want to, even after hours. So our pharmacies are very focused on that direct patient interaction and pick up their phone, but they're not always there 24/7. So this allows that extended reach, and then it also reduces technician workload and prioritizes some of those more complex cases for the pharmacist attention. So we've seen in pharmacies that have implemented this up to 70% reduction in calls without disrupting that workflow, and it is integrated with pharmacy systems, including McKesson pharmacy systems. So that just frees up the pharmacy's time to focus where patients need them most and not have all those distractions in terms of their workflow. And then just for our back office teams, we're actively engaging with even Microsoft Copilot, for example, using chat and agents. And I've seen many of our customers do the same. And for us, those back office teams are saving on average 3 hours a week, so that can be reallocated towards higher level tasks. And last year, my favorite thing coming out of NACDS TSE was that AI powered virtual assistant. And this year it was just incredible, the amount. I think I counted at least 20 myself, different vendors that tied back to AI related services. So I think if we have this conversation even 6 or 12 months from now, just a myriad of changes are coming in this space.
Well, your whole team that is paying attention to those trends, which is going to support our next gen pharmacists, our pharmacists that are starting to get more into clinical services, they're going to need organizations, their supporters, their infrastructure to be plugged in and ready, and not, because otherwise we're going to be left behind. And like you said, 6 months from now, Crystal, it's going to be a whole nother thing, and it's going to be, a whole nother level of intelligence and keeping up with this. This is exciting. It's so much fun to be able to interview you in these different settings. I got to talk to you in the independent community pharmacy space at IdeaShare. Now we're talking at NACDS Total Store Expo, really about how the chains are reaching out and filling in pharmacy deserts and supporting their communities, and how McKesson's part of that. And now we're going to the NASP 2025. We're going to be talking about specialty. So I can't wait to engage with your team there. But where are you off to next? Because I know you're always busy too, Crystal.
Yeah, I'm actually off to our National Independent Advisory Board meeting coming up soon, and that's where we engage over a dozen owners. Some of the names you actually mentioned today on the podcast, they're across the country, and they really help give the voice of community pharmacy and the programs and support solutions that McKesson provides on their behalf. We engage with them usually at least 4 times a year, and that it's just one of my favorite meetings to hear about what they're doing to serve their patients in their community, and also where they may need our help. So I always leave that meeting really energized and with a list full of ideas. And I have a feeling we have a focus on that agenda on technology and AI. So I'm hoping to, many of the themes that we talked about today tie to what we'll be discussing with our pharmacies there in Phoenix.
Phoenix. All right. Thank you so much for making this time for us, putting this information out on the coverage that we're doing here at the NACDS Total Store Expo. Crystal, this has been exciting to talk with you. Thank you so much.
Thanks so much, Todd. Appreciate the opportunity as always.
Patient safety and health are top priorities for pharmacies across the nation. Pharmacies exist as a result of the trust that patients place in them. Pharmacies rely on and appreciate the respected professionalism and dedication of the pharmacists and pharmacy technicians who earn that trust every day.
While filling prescriptions accurately and helping patients take them correctly and safely, pharmacists also provide to patients other health and wellness services that they need and desire in a highly accessible setting that is committed to quality. The NACDS Total Store Expo brings together the leaders in chain pharmacy, and our time in San Diego was nothing short of historical.
Don't miss the NACDS Total Store Expo 2026 coming to Boston on August 15th through the 17th. And now, here's our special and final interview with CEO of NACDS, Steven Anderson.
NACDS 2025, what an amazing opportunity to gather together here in San Diego. I'm here with Steve Anderson, CEO of the NACDS. Steve, this is one of my favorite parts of the trip is meeting up with you every year. So thank you for doing this.
Oh, it's great to have you back here on our trade show floor, and we value our relationship with you because you bring great insights to all people and all watchers and all listeners. So it's great. So,
thank you.
Yeah.
All right. What an exciting time in pharmacy. As much as there is strife and struggles, there is excitement in moving forward in the role of our pharmacist. There were some technology discussions that were here. the innovation of artificial intelligence, kind of moving things forward. Give our listeners a little overview of NACDS 2025.
Yeah, this is a really exciting time in pharmacy and healthcare generally, and particularly as it relates to the health ecosystem. On this trade show floor, we have a lot of different companies. I've just talked to a couple of them. There's 7 of them that their sales are increasing 75% a year, which is pretty amazing, and they're startups and doing really well. We have a lot of big companies here, but the whole focus of this, the theme of the conference is now, new, and next, and that sums it up. We're here now. We're dealing with a lot of different issues, a lot of activities in retail health and pharmacy. But what's new? And that was the whole purpose of this discussion. We had Peter Diamandis come in from Singularity University that just blew everybody's mind in terms of AI and what's going to happen with automation and robotics and all kinds of different aspects of AI. So we're all going to live longer, by the way. So start investing now. You're going to be around a long time. But at the same time, there's a lot of activity going on. In addition to that technology, there's a confluence of other events, and a lot of it is what's coming out of Washington right now. We kind of have a sense now. We're not quite at the first year of this term, far from it, but we get this sense that it's the Centers for Medicare and Medicaid Services and HHS are really focusing on the technology ecosystem of health. We were a early founder of SureScripts back in 2001. My first job when I got here was to merge with RxHub that was had a similar platform. And they're playing a huge role in this effort by the administration, along with the likes of the early adopters, as the administration said. It's Amazon, Google, Anthropic, ChatGPT, SureScripts. That's a pretty good company in terms of what we're doing. So we're really focusing on how do we advance healthcare, and it's not, we have to, I love Jim Collins, who wrote all the books, Good to Great. You protect the core, you still what you got to do, but you have to stimulate progress and almost focus as it is a different subject, similar to what Clayton Christensen was talking about in the Innovators Deliver. So there's a lot of activity here, a lot of really great discussions, and I can't tell you, the fact that we are all going to have all these AI agents on these phones with all of our healthcare records, that plays really well in terms of what we've been doing at NACDS for about the last 20 years.
Plugging that technology into our pharmacy systems to be able to bring services that are more clinical and treatment management and digging down into diabetes. Our nation needs pharmacies more than ever before because some of our pharmacies, the attrition, the pullback, the pharmacy deserts creeping in. NACDS is an important organization to camaraderie and pulling together and brain trust and thinking like how do we move forward? How do we actually in some cases how do we expand pharmacy in different parts of the nation? So what has the Total Store Expo, where these people are all coming together, have you heard any conversations about expansion in certain areas, and what are those areas that is promising?
We're hearing them on a lot of the topics that I just covered. Agentic AI is really where it's going to be at in the future. And all the aspects that would come out of this initiative from the Trump administration focuses on interoperability, which we need to expand pharmacy services in this country. And so there's all kinds of aspects of that really relate well. And, 90% of all Americans live within 5 miles of pharmacy. You've heard me say this about 1,000 times, and you can't say it enough. But at the same time, I focused in my remarks yesterday in the general session about the pharmacy deserts and pharmacy closures. And we came up with some new polling data through our polling firm, the well-respected Morning Consult, so we can sharpen our image even and our action even more. And it's amazing. 83% love their pharmacists. That is clear, but it was really interesting that 97% of the Americans that were polled in this firm said that we need public policy to keep pharmacies open.
Yep.
And 97%. When do nearly 100% of Americans agree on anything?
Yeah.
I've never heard of that before.
Me either.
But that's pretty stunning. And in the big beautiful bill that was enacted, that was signed into law on the 4th of July this year, there's provisions in there focusing on rural health.
Okay.
And that's where, some of the biggest intractable problems that we had. We launched this Food as Medicine initiative 2 years ago, right? Somebody said, how did you know Kennedy was going to be Secretary of HHS when you launched that whole issue? And the role that nutrition plays, and we're doing, a lot of nutrition counseling in our stores because we represent drugstores, food, and mass.
Yeah.
And a lot of those are the largest retailers in the country and on the grocery side. But the drugstores are doing screenings and doing all kinds of things and doing baseline data analysis for folks. So it's really, really, really exciting right now. We're right at the right place because we have to break the paradigm, and that's what we're seeing here. These are a bunch of paradigm busters from my perspective. They're disruptors in terms of what we can do, and they understand, because one thing, retail pharmacy gave about 380 million COVID shots, and I think it seemed to me we opened the country as fast as we closed with COVID, and that is because of what pharmacy did.
Exactly.
We were yelling at the Biden administration saying, give us the vaccines, don't send it to the governors. We modeled it. We could do 100 million shots in 30 days, and that's what we did.
It's incredible.
So it's great. So everybody understands that. The American people value their pharmacists. So it's just, as you can tell, it's a really exciting time for NACDS in the industry.
All right, if listeners are listening in, they didn't get to attend, they didn't get to come to San Diego, talk to us about the event. How did Total Store Expo go this year?
It went really, really well. We have the largest percentage of retailers at this meeting than we've ever had. A third of the attendees. And when retailers come, the suppliers come, and our associate members come. So that's really encouraging as well. And there's a lot of new people here. One thing about TSE, we have two major meetings. We have our annual meeting in April, and then we have Total Store Expo in August. And at this meeting, we have a lot of entrepreneurs and a lot of people that are new to this industry and new to NACDS. And they come here and we help them. It's not a competitive thing. We want every one of these companies to succeed, even though they may be competitors on the floor. But we do everything we can to embrace them and encourage them and make introductions with retailers or whatever customers they want to meet. And that's what's really exciting about the whole thing. It just continues that. As I said, we have paradigm, busters here, right? And they all realize that. They all understand that. And it's pretty extraordinary. And, I've been doing association work for a long time, as you very well know, and that's what I love about it, because you can change entire industries through an association because they represent everybody. They check their competitive differences at the door, and they come into the ballroom, or they come in our boardroom that I'm responsible for the board, and they do check their differences at the door and say, how can we unite together to grow the industry and to make it more relevant to the American people? And they're doing it. And that's what the value of associations
I love
are.
it. Yeah. All right, NACDS Total Store Expo 2026. Where are we going?
We're going to be in Boston. We alternate back and forth between Boston and San Diego, two great cities. So, we'll be there in August next year, and we're excited to come back.
Well, I can't wait to be back and be among the superstars in our chain pharmacies throughout the nation. But I want to say a special thank you to NACDS for making us part of this show. We love being here, and I always like ending the three-part series with an interview from Steve Anderson. So thank you.
Thanks, Todd. Glad to have you here. See you in Boston, if not before.
See you in Boston.
Yep, great.